Hey folks, it's Dr. Mike. We're back here for another blog post, and today we're going to look at the 11 myths of medical exercise training. I could say the 11 misconceptions of medical exercise training. Now, we're going to break this up into two blog posts. We're going to look at the first 6 today. Tomorrow, we're going to come back and look at the other 5. So the first one is, medical professionals recognize fitness certifications. They don't. Folks, I'll tell you, most medical professionals have no idea of the fitness certifying bodies or the different fitness certifications. Quite honestly, in many instances, they're somewhat confused by all of these fitness certifications that are somewhat redundant because, again, in the medical community, the major issue we look at is, do you have a license? Are you licensed in this particular state? Have you passed your state board examination? So for the medical professionals, they really don't understand the idea of the fitness certifications. They certainly don't understand the individual fitness certifications and who's produced them and what they mean. So for you, the medical exercise professional, don't think just because you have a bunch of letters behind your name or you've told the medical professional the certification you have that they understand it and they recognize it. Number 2, MDs or physicians don't know exercise and won't refer. That's not necessarily true. Now, physicians certainly don't have the same level of exercise expertise that you do as a medical exercise professional, but they do know some bits and pieces about exercise. And this is across the board with anywhere from cardiologists to orthopedic surgeons to internists. Some physicians really get it with exercise, others don't. And I'll probably have to say the majority probably don't because it's not a cornerstone in their curriculum in medical school. And folks, let's be honest. Which one would you rather have? A physician that's really good at prescribing medications, reading CAT scans, and coming up with a treatment plan for your excruciating abdominal pain when you go into the ER at 3 in the morning? Or would you want a physician that really has the expertise in exercise? Now, it certainly doesn't mean they won't refer. It just simply means they don't understand, which means it's your job as the medical exercise professional to educate them on the benefits of exercise with regard to helping manage medical conditions. Number 3, MET is basically corrective exercise. Now, folks, this is one of the farthest things from the truth there is. With corrective exercise, it's based on the idea of finding a muscular or postural imbalance and correcting it. Folks, every medical condition may not have a postural or muscular imbalance, and every postural or muscular imbalance isn't just simply a postural or muscular imbalance. There may be some underlying joint dysfunction. There may be some underlying organic dysfunction or neurologic issue that's causing that. So medical exercise training is not just simply corrective exercise. Hey, do this exercise so we can correct this. In many instances, it goes into far greater depth, and corrective exercise really just scratches the surface. It's dealing more with muscular and postural issues. With medical exercise training, you're getting into some of the more advanced diagnosis with regard to how exercise will help manage those conditions. So the two are not the same, somewhat similar on the surface, but with medical exercise training, you're going to go into much greater depth. You're going to have to communicate with the doctor, therapist, and chiropractor, and you're working toward both short-term and long-term goals based on functional outcome measures that you've selected after assessing the client. So medical exercise training, far more involved, far more, critical with regard to helping in this overall management of chronic medical conditions. Number 4, I don't need to speak with medical professionals. Folks, I get that one all the time from fitness professionals that haven't gone through the medical exercise specialist training, and their thought is, hey, I don't need to talk to the doctor, therapist, or chiropractor about the client. They'll just see how well the client is doing when they come back. Folks, just out of a professional courtesy, if a client has been referred to you, just as a professional, you need to communicate with that doctor, therapist, or chiropractor and let them know what's going on within the exercise program you put together. Is the client progressing? Are they showing signs of improvement? Or should there be some adjustments made to the exercise program? Or is exercise just out for that particular client? The idea that you don't need to speak with the doctor, therapist, or chiropractor it just doesn't make any sense. And with that standpoint, it actually makes sense. The reverse of this statement should be that you need to talk to doctors, therapists, and chiropractors even more. Number 1, it's going to improve your overall standing in the community with regard to getting referrals. But most importantly, it's going to allow you to establish good, strong referral relationships and be looked upon as the medical exercise expert in your community. Next, MET does the same as physical therapy and chiropractic. We've gotten that one a number of times from personal trainers and fitness professionals, and it doesn't. Medical exercise training certainly doesn't do the same thing that physical therapy and chiropractic care do. Now, both of these disciplines require that you pass a state licensure, so you're licensed in that state, and you're a graduate of a physical therapy or chiropractic program. And I think this one is one that's a bit dangerous. Many of our more advanced fitness professionals, they've gone out and they've done some additional study, they've taken a number of courses, and now they think, okay, I can do the same thing that the physical therapist or the chiropractor can do. Now, let's be honest. Some of you can produce some great outcomes with clients, no doubt about that. But to say you're doing the same thing that a chiropractor and a physical therapist do isn't correct, nor is it correct for them to say they do the same thing that you do. So I think on this one, we need to look at this and say, let's stay in our lane. Medical exercise training does something unique. It provides safe and effective exercise programming after chiropractic care, physical therapy, occupational therapy, and medical care is done. And folks, quite honestly, over the course of the next 2 decades, the need for medical exercise training is going to grow exponentially, and it actually might outpace these two. And number 6, MET is best in a large fitness facility. Now, that one is very, very far from the truth. We found that medical exercise training is best done either in a client's home, obviously one-on-one training, or it's done best in a small studio setting. Again, in a one-on-one type of setting. Now, we do see a need growing for group medical exercise training once clients have graduated from one-on-one training, and then also medical memberships for clients who graduated from either group or one-on-one training. But this being done in a large facility, we actually find in many instances the large facility does not work well for medical exercise training. Many large facilities are based on the idea of as many memberships as possible coming through the door. And with the medical exercise training client, it's a little bit different. This is really based on more quality training, based on more communication with the doctor, therapist, and chiropractor. And these clients take a little bit longer. So medical exercise training is best done in a one-on-one environment, either in a small studio or in the client's home. Now, it certainly can be done in a large fitness facility by dedicated medical exercise specialists that are working one-on-one with clients. But to say it's best done in a large facility, not quite so. Now, these are 6 of the 11 myths. We'll be back tomorrow with the other 5. If you have questions for me with regard to these 6, email me at drmike@postrehab.com. And to subscribe to our blog, if you're not on it now, go over to postrehabblog.com to register and to subscribe to the blog. Thanks a lot. Have a good evening. Bye-bye.